Non-Hodgkin's lymphoma affects your B cells, which are part of the immune system that fight infection and bacteria. And what happens is the immature B cells get stuck in various stages of development, and the more immature they are, the more profound the symptoms, because immature cells can't function like mature cells. They multiply out of control and they don't die when they're supposed to, so then you have a bunch of abnormal cells that can't function outnumbering the normal cells, which makes you more likely to get sick because your immune system is compromised. It originates in the lymph tissues that are outside of the lymph nodes, so spleen, bone marrow, thymus, tonsils, GI tract, and then it can spread to any of those tissues, including the lymph nodes. Abnormal cells start collecting in the tissue that's affected, and they form malignant tumors, which are called neoplasms. And then these tumors can spread to other tissues, and symptoms will depend on which area of the body is affected. So the first general symptoms that you might notice are fever, fatigue, night sweats, and weight loss. And then more specific symptoms would be, for example, if the GI tract is affected, the tumor can cause a bowel obstruction, which can lead to vomiting, constipation, and possibly even bowel perforation, which can lead to bleeding and infection. If the liver is affected, the tumor can compress the biliary tree, which will cause bile to back up in the liver, which can cause jaundice. And if it affects bone marrow, it looks a lot like leukemia, because the tumor will crowd out the platelets and red blood cells, which can lead to anemia, shortness of breath, fatigue, bleeding, and bruising. And it can also compress the ureters, which will block flow of urine from the kidneys to the bladder, and urine can back up, and that can cause kidney infection. And it can also compress the spinal cord, which would actually cause paralysis.